Welcome to another video. Today, I'm probably going to be giving one of the most interesting, most important topics and protocols I have ever placed in my YouTube channel. And it's because I've had a bunch of clients lately, brand new clients, that they come at me and they tell me, Coach, my prostate is done. I need a miracle. Could you fix it? Of course. I take it serious, and as a health professional, I always look at you guys, and I do care. I listen to every single detail. So let's refer to it in the medical term, how it is. And this is actually called BPH. So BPH is benign prostate hyperplasia. But what in fact are we doing? What I want to bring to you guys today is how we could cause shrinking of the prostate enlargement. And there is a couple of really soft spots in this topic, but stay with me because it's going to blow you away. So if a doctor tells you that there's nothing they could do and they only want to give you an AI, don't listen. There is ways to do. There is a doctor. There's doctors that they are changing their ways. I've actually had the experience and the ability to contact some of them and go over my protocol, and they are changing their ways of treating the patients. But let's get to it, right? So how do we shrink the prostate? What is this protocol that Coach Elias has brought to you guys? Well, in this place, we have to think about a couple of things. What are you experiencing? What are the things that we have to stop doing? Are steroids bad? Are they bad for us? Or is this just a little game they're playing in Big Pharma? Well, let me tell you what. We are right now almost hitting 2023. And thankfully, our impact as bodybuilders and as research developers, scientists, has marked many doctors around the globe. So the first thing that we need to change or to do, or we need to stop, is these things. So let's go by the list. First thing we want to stop taking is going to be some medications that are not steroids. Correct. So let me give you an example really fast. If you have a fever and you take Tylenol in fact will elevate your liver enzymes, will start to diminish and to increase the enlargement of the prostate. But if you take 10 anabars or 10 dianabols or whatever in a week, this won't happen ever. Let's get to it. The medications that you're supposed to be stopping immediately, and I'm going to go through the side effects on what you need to look for when you have BPH, are these antihistaminics. So these are basically, you know how we had this little crisis and a lot of patients, a lot of people around the world are taking loratadine, Zyrtec, sertraline, cetirizine. I mean, there's so many Benadryl. We have to stop these. Stop these immediately, because the only thing they do is that they saturate the actual gland. This is like a little chestnut. This chestnut has two little spikes like that. Let me not go into medical terminology. I don't want to lose you guys. And then we're gonna have the seminal vessel and another seminal vessel right here, right? And they're basically enlarging the prostate. So now things are starting to change down there. You're like, Coach, something's wrong. I'm depressed. I need to fix this fast. I don't care what to do, tell me, I'll do it. Well, guess what? When I tell you what it is, I was blown away too. But it works. It works. So I know what to do. But let's continue. Another one that you want to stop completely taking is decongestants. Yes, decongestant. This would mean Robitussin, this medication that they take NyQuil at night to sleep because it has a little bit of melatonin. No, don't do that. Don't do that. These are bad for you. They actually interrupt the process of any steroid or hormone in the body anyway. So if you're a bodybuilder, you're not supposed to be touching these. They will connect into the 7th and 9th atom. We don't want that. So in this case, they only worsen the frequency of your urination at night. So now we're touching bases on what some of the side effects that you're starting to see. And if this is you, you might not even know that this is happening to you. Sometimes there's no symptoms until you start taking a bunch of things or something changed or you got really sick and then all of a sudden, boom, life-changing event. Now you're depressed. Now you think you have cancer. Your brain is powerful, but make this brain really, really thoughtful, meaning change what's going to happen. And there is a way. So the next one that we are going to stop taking is non-steroidal anti-inflammatories. So basically Advil, Motrin, any NSA. So I'm talking about ibuprofen. I have some clients that take ibuprofen. I have some clients that say, hurts, coach. I had to take naproxen. Don't take naproxen. There's other ways. Food heals. Food, if you're sore, you need to sleep and you need to eat. There's no reason why you should be sore after 24, 26 hours. There is no reason. You should rest and you should eat plenty of food. I'm talking about we need at least 7 hours and 43 or 44 minutes of REM state. So yeah, it's over the limit because to go to REM state, you need at least 42 minutes. And this is done under my rule of restriction in my encyclopedia. And I will teach you guys that in the future. I'm gonna release this encyclopedia pretty soon. And it's gonna be beneficial for the entire world and doctors too. So let's continue. The next one that we have to stop taking is one, but there is a little catch to this, opiates. Why would you stop taking opiates if opiates have almost zero side effects? Well, in this case, opiates have one single thing, and I need to correct this right now. Opiates do not elevate liver enzymes. They do not. If a doctor tells you that, it's because he does not want to prescribe it to you. That is a fact. That's science. It's in every science book. It's in every medical book in the world. If they don't know their thing, stand up for yourself and fight for your freedom. And no, if you have pain, control it. However, opiates, what do? Constipation. Any doctor that gives you an opiate, he's supposed to be giving you a laxative. In this case, they're gonna always go with the first medical choice in the book, which is docusate with sinusitis. Docusate by itself will not do anything to, alleviate the constipation. And you need sinusitis because the synergy between both will amplify the effect and stimulate the vibration flow to actually push. And you're like, oh, wait, I feel it. Okay, let's go. Boom, you go normal. A normal state. You could continue taking opiates if you are taking already a laxative, like the only one I actually recommend, and yes, I do recommend this one. It's docusate with sinusitis. Now, let's continue. And another note, we should always, no matter what, look, learn, read, whatever you want. Find out. Go to another place. Check something else. But when you find the truth, stick with that person. Stick with that person. Because that person's fed up. And they're ready to show the world everything. Now, What if the other ones that that the doctors are prescribing, they're not supposed to be prescribing these because the books already changed in the pharmacy field. And they do prescribe a lot of tricycle antidepressants. But these are used only, right now, they're only supposed to be using them for something neuropathic, like fibromyalgia. Fibromyalgia is a real condition. It is a condition where patients are basically evolving into a state of pain and explainable. So most of them are referred to like a psychiatrist, and then they end up, into neurologist, and he's like, oh, let me check this guy out. So he starts to do this and that and see how your reaction time. If you have a good reaction time, he wants to see if that actual elevation of your normal adrenaline will cause a effect, because fibromyalgia gives you headaches, tension, every cephalea. You could feel in the hands. If you squeeze something, open something up, you're like, it hurts. Your body hurts all over. The stump of your feet, everything hurts. So, going back, these medications are only for those two things. If they're giving you this for depression, that is not regulated anymore for that. They don't use them. That's it. You're supposed to be not taking non-tricycle antidepressants for any depression. None. It's changed. Why? Because they already found out that they don't work. They don't work. They work more into like neuropathic disorders and things like that. Okay. The other one, as bodybuilders, when we're cutting and we're going to the stage, like I will be in this following year, we do take diuretics. And there's people that have congested heart failure and other conditions that if you're watching this video, listen to me. Diuretics, yes, they will increase the frequency of urination. That means you're gonna feel like, oh my God, I'm intentional. You gotta go all the time. It hurts. The less, it's harder to go. You feel like something is stuck there. You can't go anymore. You're like, I don't know why I did this. I'm never gonna take it. Don't stop taking it. Just drink Pedialyte. Have plenty of water. Regardless of whatever your coach tells you, a good coach would never tell you to stop drinking water. Ever in a stage, ever. Run away. In this case, you have really to put thought into this. Diuretics are a blessing in bodybuilding, but you could use them for a couple of good things. In this case, I will not recommend you to stop them. You have to consult this with your doctor. If you're having problems, we will fix it. Stay in the video. I'm gonna show you everything you need to do, and it's amazing. I promise, it's gonna blow your mind. So, what other things we have to check that could cause you to urinate a little bit more? Cause polyuria, which is a condition where you're constantly going and urinating. In this case, coffee. We give bodybuilders coffee. I give my clients that are competing vitamin C in coffee. Vitamin C is essential to actually decrease the prostatic inflammation. So if you're gonna drink coffee, all the doctors are gonna tell you stop drinking coffee because you're gonna urinate more. Guess what? Vitamin C destroys that. Just take the vitamin C with the coffee. Boom, you're good to go. It works. Now, let's keep talking. In this case, what are the symptoms, coach? Coach, I'm having these symptoms, and do you think these are real? These are things that are happening to me that I should like be concerned about? Sure, but let me tell everyone what these are. Okay, so one of them, I already talked about polyuria. Let's talk about nocturia. So nocturia, what is nocturia? Nocturia is when you are going to sleep, you're in REM state, and all of a sudden you wake up, you gotta go. Boom, you go. You like seem to like just a little bit, and then you stop, and you just can't completely unfill. You can't. There's no way. It could happen. And then you go back to sleep. Maybe 5 minutes later, you wake up again. You're like, man, what the heck is going on? I can't sleep. You know, I got to keep waking up. This is bad. It destroys your muscle growth. It destroys your day. It gives you depression. It will lead to having catastrophic events, arrhythmias, a bunch of things. This is actually a really serious condition. If you are urinating at night and not taking diuretic frequently, and I'm talking about you could not just let go of everything, then yeah, you have to listen to this video and do these things, okay? Now, so basically urinating at night. Remember it. So just in case someone asks you, nocturia. The other one is you're gonna feel like a hesitation of urine coming out. And it's like almost like a stream. And you're like holding that stream in, but then you're really not holding it because it's not coming out at all. And you're driving, you're like, what the heck? I gotta stop. When you stop, an emergency stop, you go like try, you're like, the fuck? No, this is strange. It's not coming out. What the heck is going on? And then after that, you see like a little bit of seminal fluid. You're like, what the heck is going on? I had sex the other day. No, wait, this is strange. This is like out of control. That is a symptom. Next one, you're gonna have like a weak or a slower stream. So this means you go to the bathroom, boom. Oh, this is not like as strong as I used to go when I was doing this cycle, when I was doing this, or when I was 15 or 18. You're gonna know. So in this case, you would go to the movies with your wife, with your kids, with your girlfriend, significant other, with your teddy bear, whatever the hell you're gonna go out with. And in this case, boom, you have to consistently just stand up. You're with her, you guys are like passionate, you're gonna start that, and then you're hugging, it's like all the cuddle and all the beautiful love. Boom, all of a sudden you're like, hey babe, I gotta, she's like, man, girls get fed up with that. Dude, you need to be her king. This means you need to take care of your health. Take it serious. Be like, hey babe, I got a situation, I'm gonna fix it, and don't worry, I got you. Boom. Now, the other one is decreased ejaculation. She is just right there, or you're, doing your thing, and it's not the same. It's like less. You're like, but I used to do like explosion, spraying like everywhere in her whole, you know what I mean? And it was insane. And you're like, she liked that. You're like, you felt manly doing that. Anybody does. And then you see like just, what the heck is that? Come on, man. Do your thing. That is bad. That is a symptom. The other thing is, when you are at the last state of having intercourse, sex, anything, love, whatever you want to call it, you will see that you have exactly at the moment of orgasm, when she's orgasming, boom, pain during the ejaculation. This means like a bulge and boom, release. And you're like, oh my God, that hurt. You don't tell her, but she's like, what the heck happened? Your face was different or something. That I had a lot of clients tell me exactly these words. She tells me my face was different, man, but it was hurting so much. I'm like, okay, let's fix it. That is one of the most important symptoms. That is like almost 100% you have a, exactly insane growth of the prostate. That is the one that the doctors are like, oh my God, this could be cancer. But I'll get there. Now, the other thing is dribbling. When you have a dribbling penis, this means, or either you urinate, and then after you urinate, you just like keep, shaking, and then a little bit comes out, and then you just keep, and then you guys just sit and wait, and you're like, man, and then you push hard, you're like, and boom, it goes, and you're like, no, this is not normal. Yes, it is not normal. Coach, that's not normal. Yeah, I know, it's not normal. We'll fix it. And there's a couple others. So the other one is trouble holding it. This means you have the situation, it's been going on for a couple of months. You're too scared to talk about it. You don't want to talk about it at all. And now you have this trouble where you're going to be holding, and then all of a sudden it just comes out, and you just, you just damaged everything. So in this case, trouble holding where you have to run really quick, that is bad. That is a symptom. The other one is low back pain. Coach, I have this all the time. Coach, I want you to be my coach. I have this coach, he's doing this. I'm not gonna talk bad about any coach. Just, if you're a coach, look into every single thing in their cycle and every single thing in their health, and then make their program, and never create a program, an extended program. You know that's impossible. If you have a client that goes hard at the gym, yeah, it could fluctuate. There's going to be some changes, but never create a program where you're going to just say, oh, just this week do this, this week do that. It changes. The body changes. So that's another topic. But in this case, trouble holding it and lower back pain. Lower back pain is one of the most serious ones. That one, I actually personally feel like for me is the most serious one. Why? Because when you have lower back pain, this means that the actual prostate is not only saturated, but it's actually inflamed, and the saturation is happening because all the foods that you're eating, especially the red meats or anything with collagen, the collagen is not being processed. This is when people just buy any random collagen around there, or any maybe a drink of collagen, and you don't check if it's hydrolyzed. If it's not hydrolyzed collagen, don't drink it. Don't drink it. Don't take it. Why? Because it doesn't work. It just saturates the actual prostate, and it will destroy you. It will destroy you. This is why I always tell my clients, let's only have maybe one time a week red meat. Maybe twice if you work out 6 days. That's it. If you're doing 2 workouts a day, I do allow them 2 times, two times in one day, and then so basically 3 times. 6-day workout. This means you're working out 2 times a day. That's exactly 12 workouts in a week. That's insane. That's how it is. That's what it takes. Now, another thing that we have to talk about, when you are seeing back pain, if you have the back pain right now, and you're like, man, yeah, it is the back pain. Wait, guess what? Now something else is happening. This situation is actually aggravating the kidneys, meaning that you have right now the inflammation that has made all the urethra bigger, wider, and crazier. This is bad. This is terrible. This is so bad that it's almost irreversible. So if this is happening, you got the back pain, you need to do this protocol ASAP, and I will get to it. Now, the other thing is, this is like the worst case, blood in the urine. If you see blood in the urine, maybe the seminal glands are already like overflown. It's so saturated because it's almost like a little, let's say this is the actual, this over here is the actual prostate, right? And you have like little veins that go like little dots, and it's almost like a chestnut, right? And this chestnut has 2 little wires like that, goes boom in the back urethra, and then they actually go and enlarge. They also enlarge, and everything inside there is going like this, and it's not letting the seminal fluid get out. So when it goes, it's almost like breaking and crushing your gland, and that could cause you not ever have babies in life. So in this case, you see that the saturation could actually make the actual canal really narrow, and it will not allow for proper ejaculation. So in this case, blood and urine. Now, the other one is when you're going to the bathroom and you're not emptying completely. I already went over that one. So you have to always remember that it's actually the most important thing. If you're presenting one of these symptoms, do this protocol. So next thing we're going to go over is what happens if you don't take care of it right now. What will happen if you don't take care of it right now? Basically, you're going to decrease urethra. This is going to cause the thinning that we talked about. You're going to have cancer, CA. This is related almost in every patient that has back pain. So we're talking about like serious effects. And then it leads to depression. You're always scared. You don't want to talk about it to anybody. You feel like it's the worst thing that's ever happened. It's down there. You heard about the prostate exam. You don't want no one putting your finger there. Yeah, that's, man up, man fuck up, and stand up for yourself. Stop that. Stop it. If you have kids, if you have a wife, this is normal. This is normal. We all go through this. Everyone goes through this. Everyone. So eventually, one of these symptoms will happen, and it could be fixed easy. There is a way, and it's almost perfect because you don't have to spend, or it's actually really beneficial in every way. But let's continue. The other one is the prostate enlargement. You're gonna have more prostate enlargement, meaning that then they're gonna have to go in there, break it, actually burn some of the area, some of the tissue, to canalize the growth, and then start doing something else that I'm not gonna mention right now because I want to actually expose it at the end, or almost at the end of the video, because it's really important that I explain it right, and I don't want anybody just going doing it without listening. In this case, the actual prostate enlargement is really serious. It causes you to have something called ureteresis. Ureteresis is what I explained. It creates a bigger urethra, and it going up to the kidneys, and then you get the back pain. But what is the prostate growth fueled by? We have to learn why it's fueled. What fuels the prostate growth? What does it fuel it? You know, what is it? Easy. Okay, so right now, you have to think, what is your age? What is your age group? Are you young? Are you 40? Are you 50? Are you doing exercise? Do you look how great? Do you feel good? These kind of things. So aging is one of the things that you have to consider when we have to look at the prostate growth. So in this case, prostate growth is fueled by aging. And we're talking about almost everyone that's 40 and above. However, bodybuilders from 18 to 39 will have prostate enlargement if you're not doing it right. If you're not doing your cycle right, you will have prostate enlargement. Now, it could also be fueled by a rise in DHT. Yes, taking too much testosterone, or maybe a TRT dose that you think is right and it's not correct for you. You should always test how much you need before you actually establish a TRT dose with your health professional, your doctor. In this case, your endocrinologist. Now, it could be that right now you want to say, man, I'm not going to stop testosterone. No, I'm not going to do that. Yeah, I don't want you to stop testosterone. Don't do that. That's stupid. Don't stop testosterone. Now, the first thing you need to do is go and do blood work. Check if your testosterone is high. You have these symptoms? Let's check that out. But before you do that, before you leave, I'm going to expose another test that you have to put. So hold on. Okay, in this case, the other one, inflammation is also fueled, is one of the things that fuel the growth. Oxidative stress. This is always going to make that happen. Why? Because stress actually happens there were 7 forms of stress. And these forms of stress, one of them actually is so intense that it could actually start converting into DHT. And this stress, meaning that it's cortisol, it's allowing your body to just feel really bad. So bad that it could cause a condition in the skin called neurodermatitis. Neurodermatitis is caused where you get like a little patch and then it scabs up like almost like a ringworm. People confuse it with ringworm. It's not ringworm. It's actually stress. This means a lot of influencers get the YouTubers or anybody that has a lot of work, videos, clients. It could happen to me. And in this case, it does exist, and it's really, really horrible because you could get it like in all your face, all your hands. It happens in the wrist. It happens in the back of your neck, in the chest area where you're pinned. And you're like, man, did that happen because of the pinning? No, it's not happening because of that. It's happening because of the stress. the cortisol level that's going up. So oxidative stress is another way that will actually fuel the prostate growth. The other one is prostate remodeling. And you guys know I love evolution. So this one, I want to touch bases, but almost. What is prostate remodeling to you? Well, I'm going to throw it out there that it's just like an evolution. It's part of the protocol. Prostate remodeling. How do you remodel a actual prostate? If you see the prostate, it's like that. How do you make it like normal again, right? I'll tell you the secret. There is a secret. Now, this is done because when you want to do actual prostate remodeling, you have to remember one thing. It could only be done if your actual prostate is clogged up with not too many factors that attribute to it to heal. Meaning you're going to have further deposits of collagen, minerals, calcium, almost like rocks. It's horrible. Then this is where everything that they say about CA happens. You don't want this. You don't want this. So prostate remodeling, remember, you do it if it's always inflamed and it's saturated with something inside of it. It could be from some of the items that I'm going to be mentioning soon. Now, the other one is the androgenic. So androgenic antagonists. Androgenic antagonists. It could be fueled by androgenic antagonists. You know, it's AIs. I hate AIs. I do. I honestly don't think that there is other ways. There's other routes to actually cure. And if a doctor gives you a actual androgenic antagonist, it's not going to work. Why? Scientific data. I read so many articles, so many scientific studies, just to make sure that this video is 100% for you guys. And it says that 1/3 of the population in the earth, only 1 out of 3 men will actually experience 42% of healing, where they see a decrease. But this decrease happens because they also correct the diets and other things. So it's like, man, this is the most stupidest way to control the actual prostate. And the doctor I talked to, I told her, look, if you change this, this is going to change everyone. It's going to change the world. Why do you want someone lethargic? Why do you want someone to, like, you know how many side effects AIs have? You know, androgenic antagonists are really, really insane, including the others. So don't do it. Don't do it. Don't do it. Stop right there. If you're taking anything that is, or either letrozole or Nova or whatever the heck, a Serm, or I mean, whatever the heck you're taking right now, stop a minute. Let's think about this really quickly. There's other ways that we could actually handle it, and it's going to impress you. It's going to be amazing. It does work. Now, the other one is we are going to, okay, so, oh yeah, I love this part. So what could I do, coach? What could I do? Well, first, we need to look into the diet. We talked about the diet. So make some changes really quick and listen carefully. Grab a pen, stop the video a second, grab a pen and paper if you already have one. This is a serious video, and go. Let's do this. And let's go. Okay, so when you make some changes in your diet, you have to actually think of something that is going to heal it and why, but you don't know. So as bodybuilders, we are always supposed to be eating healthy. But most people that are bulking, they don't eat healthy. They like to eat whatever the hell they want, you know, including bad things. Some people are not supposed to be consuming alcohol, and they consume alcohol. So alcohol is one of the first things that you have to eliminate from your diet. The other thing that you have to eliminate is dairy products. So in this case, if you are drinking milk, even if it's an ounce, is going to be it says it's 98%. 98% is almost everyone. You will have cancer in the prostate if you're 42. That's what it says. You could look in every single science book. You could look in every research, whatever's, study that you could find in Google. I did. I read about 18 of them, and all of them said the same thing. They always related to the other one. The other one related to that one. I'm like, man, this makes sense. It does. I even made a video about why you're not supposed to be drinking milk. Yeah, it helps to, people that are actually wanting to bulk. It does work in the muscle, but it's horrible. It's disgusting. It's just one of the worst things and terrible things that you could do in your life. But, having to balance it out, because I know people like milk, some of them, just change it, man. Be wise. Open your mind and change it. This time, just find almond milk, silk milk, something that's similar. Oat milk, which is so popular right now. And one of the things you have to discontinue is the dairy products. This will give you cancer. 100%, you will have cancer. And then what do you have to do to take the cancer away? There is a protocol. I know which protocol it is. And you will be eradicating your CA. So in this case, the risk is associated more frequently in patients that drink milk. That is horrible. The other one that I was impressed was caffeinated sugar carbonation beverages. So in this case, that we have that tooth, that we feel that sensation where we're like, oh man, this is awesome. I needed this. I need like some water with soda, or it could be. There's so many of them. But if it's caffeinated, if it has sugar, you are just gonna have cancer. That's it. Now, if it's caffeinated without sugar, and it has carbonation, you're done too. You're done too. Why? You're like, Coach, that doesn't make sense, man. Explain why. Yeah, I'm gonna tell you why. This is the best part. Critical thinking, logic reasoning. You drink any soda pop, anything. You're like, what do you feel in your throat if you just continue to drink? Could you drink all at once? No, you feel like this, oh my God, like burning sensation. Guess what? It irritates the prostate so much that it could cause 107 times the excess of the inflammation, meaning that you will have immediate surgery. Don't drink caffeinated drinks with carbonation or whatever beverage that you love to do. Don't do it. Stop it immediately. Let's heal you up. And then in just 1-2 days, you're going to be brand new, and it's going to change your life forever. Now, the other one is juice. What, Coach? But you told me to drink some juice. I'm bulking. Yes, I did. But there is a problem here. There's a lot of science studies that says that juice is bad. But I was like, man, I don't believe this. You know me. I don't believe it till I find out why. They have to explain it to me, break it down in details. So finally, I found about 8 different science studies said why juice is bad when you have the prostate inflamed. Well, so easy, man. It was right in front of me. Juice that is processed with sugars, with preservatives, it will irritate the prostate. That makes sense. Isn't that beautiful? Now, we could continue to drink juice, but how are you going to drink juice? Easy. Don't buy it in the supermarket. Don't buy it anywhere. Just buy the fruit. And you could have orange juice, grapefruit, lemon juice, any juice that you like, but it has to be fresh. I'm going to give you now one of the first things that you could actually take to control the inflammation right now. You grab 1 orange squeezed, 1 lemon, 1 grapefruit, 1 passion fruit, a half of a beet, or beet powder, which is almost organic all the time, 2 strawberries, 2 ounces of broccoli, 2 tablespoons of apple cider vinegar. And I promise you, you're going to remember. It's going to be amazing. This is actually a drink. There's many drinks, but this one specifically It starts cleaning the actual prostate. It starts a process of evolution where you go back to the first time, reaches mother cells, and boom, you're like, I feel like I was 15, but let me go. Look, there's other things we have to do. Not only this is just a drink. Anybody could do this and they don't even know, oh, I was drinking. Oh yeah, that's why I didn't have. Oh yeah, that's why it went away. Yeah. Okay, so in this case, remember that one, but let's actually go back and remember the secret you guys wanted to know about. I'm gonna expose it. There is a secret. So in this case, what could I do, coach? You remember I told you there is a process where the prostate has remodeling? Well, the remodeling process is done through vibrations. The vibrations happen directly into the prostate. And it's a weird procedure. I'll talk about it a little bit. And I'll explain a lot more in detail. But the process is with a prostate massager. You know the things that females use in maybe movies or maybe porn or whatever. You know that they have or the dildo or they have something they stick up their anus. Well, in this case, there is a prostate massager for men, and it's something beneficial. I was completely closed to the idea because I said, man, I'm never gonna let anybody just, I'm not gonna do that. Hell no. I was like, no. And then I said, you know what? I need to expose it. I need to tell the client, I need to tell everyone about this. So yes, you need to buy a prostate massager. And it has to be one that vibrates. Why? I created a formula and I was blown away with this study because the doctor that was, we were talking about, she said that the vibration of the actual prostate massager was causing some of the cells to signal. And I actually found out and I formulated a theory that I made into an encyclopedia of a formula for evolution, where you force heal, you force oxidative tissue to lose fat, or you force the body to grow. In this case, with vibration, and I have a little machine for it, you could see different patterns that the vibration would do. And in this case, in the world, everything evolves. Everything is evolving constantly with the vibration of the earth. But in every cell, I do recognize 100%, because I've done it, you have more growth. There is ways to heal, force healing in time. You know the time is going to happen. And that's another topic. But it's so amazing that this doctor also had their mind open to some discovery that I found out by myself, and it needed more. And now I could actually help her and help him to establish something for all the medical field. It's insane. For me, it was amazing because the formula was done helping a client to heal some area of his body. And it was just like in front of me. And I just started playing with the number and I said, wait, why at this hour? Why at this hour? So what if I do this and this? Could I find this? And yes, I gave the name to it. I'm not going to even tell you guys what it is because it's going to be in the book. And it's going to be, first, a little controversial, but then when you guys see it works, do it. Do this one. You'll see it works. Okay, so in this case, get the massager, and then it has to be one that vibrates. The process is done. There's both ways to do it. Internal, so you go through the anus, and you go into the area where is your G-spot that also has a name. I'll explain later. And there is a way to massage that area where you feel like a little urge, like almost like going to the bathroom. And it almost feels like a little pain, but then you're like, oh, wait. And your life changes. Every person that I talked to that did it, they said, dude, you have no idea. This shit has changed my life forever. I feel like I'm 15 years old every day. I have morning wood every day. my seminal fluid is insane. It was off the charts. I'm talking about like maybe 2, 3, 4 ounces. It replenishes faster. The massage is perfect. It does help. That is the secret. That is the secret. However, there's other things that we have to explain. So you guys do it right and you consider it and you look more into it. Because if you do it, this means you don't have to wait till you have cancer for them to say, hey, we have to operate or, take it out or something. You don't want that. You don't want that. So it will change your life. You will feel more flow immediately. The very next day, you feel more passionate, more responses to touch, to feel, sentimental, because it does work. When you do that, it does trigger the actual liver. And the liver is the only organ in the body that signals what? Sentimental value. So if you feel love, if you feel care, if you feel passion, it's through the liver. If the liver is working well, you should be able to cry. You should be able to feel things. When you're not feeling anything, there is a problem with the liver. Check them out. They might have elevation in the enzymes. So you have to be assertive to identify this and identify every symptom and to actually find a good one. Well, I'm probably going to place a link in the description so you guys could, if anybody's going through this, Zoom call, one-on-one consultation. I'll guide you through the process and you could do it by yourself. I'm not doing it with you on camera, so you could do it by yourself. But if not, you could actually go to a doctor. He will explain to you, and any doctor. It doesn't have to be me. And anybody you feel comfortable with. But in this case, I'm gonna explain to you guys exactly how it's done, and then you choose whatever you want to do. But it will be fixed forever. I guarantee you. I give you my word. Now, we are going back to finish this topic a little bit, but you remember I talked about a juice, right? There was a beverages that we could drink and everything. But what other foods are important to actually manipulate the growth that's happening in the prostate? Well, there's a couple of other foods that we use to help decrease the actual enlargement of the prostate. The first thing is physical exercise. If you don't do physical exercise when you're starting this protocol, before you go into the vibration of evolution and doing this massage in the prostate, you have to remember to do this part first. This is why I didn't want to put it at the beginning, but I know people are desperate. Not everybody could watch 47-minute video. So in this case, it's going to be a little bit longer, but it's working. So let's continue fast. What other foods help decrease enlargement? Well, foods first, exercise. Remember that. The other one is going to be tomato. But why tomato? Why you need something that could actually hurt your intestine, right? You're like, man, why? Tell me, coach. Yeah, I'm going to tell you. It has a compound called lycopene. Lycopene helps because it will actually almost eradicate the growth of the actual prostate. But how much tomato, coach? 230 milligrams, mLs. Remember that, okay? How much? 2 times a week. That's it. That's what it's in the medical field. That's what it says. And foods that you could eat. Beet juice powder or beets. Guava. We could have palm juice with the seeds. The seeds are important. They have protein and they have other beneficial properties where you are going to maintain yourself perfect. And what else? We could have carrots if you have too much acid. Or if you have if you don't have anything happening to you, you want to eat the tomatoes, remember it's 230 milligrams. And in this case, you don't want to eat them, just eat carrots. They also have lycopene. And one of the things that they also have is antioxidants. So we're looking at, to fix it, we need a lot of lycopene and we need a lot of antioxidants. And we need to include fibers. What is the most fibrous food in the world? Avocado. Avocado right now is one of the most important foods for your prostate. So include that, include chia seeds, linaza, anything that has sesame seeds, or just plain sesame seeds. You could throw them in top of any chicken or anything, or just, your rice. These are fibers that are important. There's others, but right now these are the most beneficial. I'm not going to bring up other differences. The other thing I want to explain is that a lot of people eat fish. Is the fish clean? Find out by yourself what fish is the cleanest one and which one has more of a fatty ingredient where we could see omegas, right? So I prefer salmon. If you're gonna eat a fish for this protocol, I would only put you on salmon. This means you're gonna eat clean, you're gonna eat salmon. We also are gonna be doing a diet where you're gonna be consuming nuts, and I'll tell you why. But it's really important that you remember before you go into the vibration protocol with your massager that you have to actually remember to do this before you do that, because it will work perfect if you want to do both things. Once you complete your diet for a week or two, if you see everything's normal, boom, you did great. Nothing happened. If not, you have to go to the Genmo point. What is the Genmo point? The Genmo point is the G-spot on men and women. Women don't have prostate, but G-spot, yeah, we have one. It's called the Genmo point. And so you need those fibers. Remember that. There is other things that we're going to go through really quick, and that is going to be the most important one. So don't leave. Zinc. We need zinc. It's so important. Zinc is so important, so vital, that this is why I give this to my clients. This is why I give it to you. You're like, Coach, man, but why so many? Yes, zinc. Check this out. If you, for any reason, were taking a lot of testosterone and have zinc, a lot of zinc, you're probably not going to see any elevation or any enlargement of the actual prostate. And this is really important to remember, because in this case, you do need zinc. But why, Coach? Why do I need zinc? Well, it inhibits 5-alpha reductase. It also inhibits prolactin. That means milk labor. It allows it to stay balanced out forever and indefinite. As long as you have zinc in your system, it will not let you. It's impossible. Medically proven. I was blown away. Beautiful, beautiful stuff. The food that contains the most zinc in the world, what are they? Brazilian nuts, cashews, almonds, peanuts. I go in those orders. That's the order I would recommend to any client. You have to have these in your diet. How many times? 1 or 2 times. How many? 21 almonds, exactly 15 Brazilian nuts, exactly 18 cashews, and peanuts, you could only have 17. And in this case, it would be 2 times a day. If you're doing a bodybuilding, lean bulk or cutting or bulking, it doesn't matter. You'll be okay. Remember, these also have a lycopene, which is great. And I love it because we found that most of these include a little bit of omega. But you have to remember that there is other fruits. Remember I told you about the juice? You don't have to just do it with that one. There is fruits that I do actually appreciate all my clients to have. Don't be scared of fructose, and don't be scared of fruit. One of them is papaya. Any citrus fruit is okay. Some scientific studies say that citrus fruits are bad, but they only say it because they're referring to the juices that are citrus would have sugars. Remember that. So I had to read it like maybe 6 times, and then I found it in one of them. It says specifically sugars inside the actual fruit, added sugars. And I said, added sugars. Okay. Also alcohol sugars. Be careful with alcohol sugars. Now, remember, these are some of the things that you could actually do. Remember to take zinc 2 times a day, and You don't have to go, overdo it. You could buy the gummies. There's gummies for it, and they are amazing. So start here. Tell your doctor to perform a PSA. So if you want to start this today and you want to find out, this is the proper way and the rules I would actually implement into following this protocol. Get a PSA test. What is a PSA test? PSA is a prostate-specific antigen test. So the prostate-specific antigen test is a rare protein. This rare protein is actually really rare because it's only produced by a normal process. However, it can be produced by malignant cells. What does this mean? If you're producing this and your actual prostate is normal range, you're gonna be happy. Everything is gonna be perfect. But if a cell that is malignant or cancerous is producing it, you're gonna have over the amount it's supposed to be allowed. And that is terrible. This is why this is the most important step of this protocol. After you do this, you're gonna find out if it's 100% elevated. Either your doctor is gonna tell you to, do something about it. Most doctors are just gonna prescribe you an AI. If that happens, show them this video. If not, just put them in contact with me. I'll be really happy to talk to them directly and show them the facts and the doctors that are changing their ways, because there is doctors changing their ways, and they are also in YouTube. Now, one of the things that you want to know is, Coach, what are the values for the PSA, man? I know the PSA test is good, but how the hell am I going to know, man? Easy. Some of the tests right now, they are including only adult tests. They only include from the 40 all the way to the 80 range, which is dumb because it changed and they're going by what happened 10 years ago. They should go by the scientific data that's established today in 2022, almost 2023. And I'll tell you what it is. So for an age group of 40 or up, it could be exactly 14 to 65 PGs. What is that? What is a PG? PGs / milligrams. So in this case, PG, just in case you guys want to know the mathematical equation for it, is picograms per milliliter. The picograms per milliliter are actually done in a formula. And this formula, I do know it, and it's really simple. So if you need it, ask me and I'll send it to you. And it's really simple to do. But you have to remember, picograms per milliliter, this is 1 trillion of a gram. Remember that. It's 1 trillion of a gram. So whenever you're going back, you have to always divide it to find if it's of 1 trillion of a gram. Now, what happened when I told you that they changed the actual range? It did change. So on your lab test, it's going to say that the normal range is 14 to 65 picograms per milliliter. Guess what? False. It's 14 to 46. It's lower. It's lower. Why? Because they don't want anyone else to have cancer. They found out that if they lower the number and they treat it, because it's supposed to be starting treatment on level 1 at 46, then you will never have cancer. So how beautiful is that? That some of the doctors actually connected together, made this science, and researched together with almost 2,000 or almost 9,000, but there's 4 of them. It's insane. So many patients. And now they know how to fix it differently. And when I spoke to them, they were in shock. They said, yes, let's do it. So in this case, what is remember, PSA test. And part of the things I want to show you about this test is that this only establishes things that are part of the endocrine system. And one of the things that you have to remember is, what is PTH? because PTH is really important. And I want to give you a homework and search it, because this is actually really deep, and the video is almost 1 hour already. And I mean, you do need to do a little bit of research with this particular one, but let me just tell you really fast the reference. PTH, parathyroid hormone. It regulates the blood. It may rise PSA levels. Now, this hormone is important. It really is important. It signals, remember the signaling I talked about? It coordinates, that's in science. It coordinates, but it coordinates in a language, a specific form of language. Imagine you, me, I talk English, you talk Spanish, you talk Portuguese. Every cell has its own language to manipulate, to deliver a transport, a action, a function. And why am I mentioning this? Why is this important in bodybuilding? Because the vibration flow of the signaling from this cell is messaging different functions in the body to include and control the growth of your muscles. And not only that, other parts and other organs in the body. So important, so beautiful. It's a beautiful hormone. But you do need to make sure you understand this hormone, because a lot of people don't touch bases on it. I'll do a separate video because it's a really long topic, but it's a really good one. So literally it tells you how to grow. And that's one of the things that I love about it. You're going to be blown away. You're going to absolutely be blown away. Now, let's just go briefly over everything, and that way you guys could start your process, the protocol. We touch bases on the foods. You remember the fibers, which the best one is the avocado. You know that you have to drink citrus, so forget that one. You know that you have to eliminate. What do you eliminate? You have to eliminate some foods, some drinks, no alcohol, and of course, there is a way. So, right now, you try to find a massager, a prostate massager. It could be any prostate massager, vibration one. And for me, it was really like a shock that this actually works, and it does work. So when you hear it, or try to listen to some of the testimonials from guys, or ask someone if they know, take it like a man. Be like, you know what? Screw it. If you don't want to do it, tell your wife to do it. It's fine. You know, it's foreplay. Fuck it. You know, it's not something bad. It's beneficial for your health. You're not doing anything bad. It's not gay. It's not gay. And there's nothing bad. So in this case, remember your Genmo spot, your Genmo point, the G point. So your G point is, so your anus is right here. This is your scrotum, right? So if your anus is right there, my mouth would be the Genmo point. So you would actually externally place the device, just slightly move, and start vibration. And do this a couple times. And you do it the other way. Why? Both ways. Because you want this area to start shrinking. It's like a sponge. And this actually stimulates, and it creates what we call the evolution technique that I love, that I was like, wow, man, remodeling. You're remodeling the prostate. That's amazing. So you start to remodel the prostate, and when you remodel the prostate, you feel like your life changed. It's completely beautiful. So this is my video. Remember that we talked about the prostate, but we have what to do. We have some homework, right? We have to start shrinking the prostate. And remember the term for it, BPH. This is Coach Elias from Enhanced Athletes. You guys know that I am out. To the next one.